Good afternoon, everyone. My name is Maria Rodgers. You have to excuse me. I'm kind of choking over here. Okay, I am a survivor of domestic violence. I was a victim for 24 years. Um, at times, people will ask me, why in the world do you stay in an unhealthy relationship for so long? And I can honestly tell you that I don't have an answer for that. The only thing I can answer you right now is that I was able to break the cycle. I left so many different times just to go back and to endure more severe abuse. My abuse was mental, it was physical, it was verbal, it was sexual, it was financial. The only thing that came out of this unhealthy relationship is that I have two wonderful kids. My son, he's 28. My daughter, she's 16. So when I decided to break the cycle, I was afraid because the times that I decided to leave, I was victimized by the system over and over. Um, I used to live up in Santa Barbara County, so whenever I made a phone call, sheriffs will respond to my phone calls. But due to the fact that, English is my second language and I was married to an American man, they always took his side. So at times I got very discouraged, and I just felt that I was not going to be able to be heard or make the difference. So as my daughter started growing up, I noticed that she was paying attention more than her brother. So I got really concerned. One of the things that I decided to do for her, not so much for me, it was to stay away from her father because I didn't want my daughter to end up with a man like her father. And I also didn't want her to think that she could abuse someone else. As you all know, violence doesn't discriminate. So, there's like the way there's women violating others, there's also men, even though the percentage is higher on men. So when I decided to break the cycle, I decided to break so many barriers. I'm Mexican. I was born and raised in Mexico City. Me saying no more to an unhealthy relationship among my family, it was a big no-no because they couldn't understand me. But I needed to do that for myself. So what is it that I did first? I was at home mom. I didn't have any source of income. I was afraid. So I had to rely on welfare. I was on welfare for almost 10 months. Within that time, social service had a wonderful program, I don't know if they have it, named Expert. So I was enrolled in this Expert program with social services. And how did it work? It will help me to get my grant of $521 if I was able to become a volunteer for a nonprofit for 28 hours. So you know what? I did that. Not only that, whenever I noticed that there was free programs, I attended the programs because I realized that I couldn't change anything around me but by myself. So I'm very blessed and grateful that I was able to work on myself. Um, I, this happened 6 years ago when I decided to break the cycle. I have become part of the Chiefs Advisory Board with the City of Anaheim, representing victims and my Hispanic community. I'm also became a facilitator for another nonprofit, um, reaching out to high-risk victims of sexual abuse and domestic violence. And then I was totally blessed 2 years ago when I was hired with Western Youth Services as a parent partner. I had been learning a lot, and one of the new things that I just learned is ACEs. And wherever I go, I like to talk to people in regards to ACEs and resilience. And I totally recommend the film Resilience because if you can have the opportunity to watch this film, we're going to be able to understand a little bit more of what happens to a mental healing. So I took the questionnaire, and I'm not embarrassed. I'm not afraid to share that. My score was more than 5. And it also helped me to understand my situation because, like I said, I was living in a very dark environment. So when I broke the cycle, I knew that things were happening with my health. I developed high blood pressure, heart disease. So when I took that ACEs questionnaire, I totally understood what was going on with me. And now I'm happy to say that I am providing information or knowledge to my community in Spanish. So my major objective is to be able to take ACEs study to my Hispanic community. And as a parent partner, I think it's very important that we also target the parents because in the past, I mean, we can work with the children, but we were forgetting about the parents because when we work with the family, healing starts. And it's also very important as a victim, as a survivor, that we treat one and each of our participants with compassion, with empathy and understanding. And I commend Abraham for being here and all of the panel because I can relate to it. And I don't want to be very long, but there's some changes that need to be done within the system. We have to try to educate law enforcement, school staff, hospital staff, housing authority. I mean, there's so many barriers now that I'm working with parents that I would like to be able to make a contribution to make the changes so the families can start living a healthy lifestyle and we can have healing communities. And I thank you so much for your time.